How do healthcare systems around the world actually work? Welcome back to the Stuff You Should Think About, the podcast where we take everyday questions, strange facts, and fascinating topics and we break them down in plain English. I'm your host, GT, and today's question is: how do healthcare systems around the world actually work? If you ever watched the news, you probably heard someone say Canada has free healthcare or Europe has socialized medicine. But are those statements actually true? Not exactly. One of the most biggest misconceptions is that every country outside the United States has the same healthcare system. They don't. In fact, countries around the world use several different ways to pay for healthcare, and each one has its own strengths and weaknesses. So let's break them down. Let's start with the system we're probably most familiar with: the United States. The U.S. mostly uses private insurance systems. Many people get health insurance through their employer, while others buy it themselves. There are also government programs like Medicare for older adults and Medicaid for some adults with lower incomes. The biggest advantage is that the U.S. has some of the world's best hospitals, specialists, and medical technology. The downside: it's also one of the most expensive healthcare systems in the world. Even people with insurance can end up with large medical bills depending on their coverage. Now let's head to north. Now let's head north to Canada. People often say Canada has free healthcare. That's not really accurate. Healthcare isn't free, it's paid for through taxes. When Canadians visit a doctor or go to the hospital, they usually don't receive a bill for medically necessary care because the government has already paid for it using tax dollars. However, many Canadians still buy private insurance for things like dental care, prescription drugs, and vision care. Now let's look at the United Kingdom. The UK operates the National Health Service, better known as the NHS. Unlike the US, many hospitals are owned by the government, and most healthcare services are funded through taxes. Patients usually don't pay when they receive care. The trade off is that some people experience longer wait times for certain non emergency procedures. Germany uses a different approach. Instead of one government healthcare program, Germany has what's called a universal insurance system. Most people are required to have health insurance through nonprofit insurance funds. Employers and employees both help pay into the system. Private insurance is also available for some people. Many experts point to Germany as a system that combines universal coverage with competition among insurers. Australia takes yet another approach. It has a public healthcare program called Medicare, but it also encourages people to buy private insurance if they want faster access to certain services or additional choices. In other words, it combines public and private healthcare. So, which company has the best healthcare system? The answer depends on what you value. If you care most about having access to cutting edge treatments and specialties, the United States scores very well. If keeping costs low is your top priority, countries with universal health care often perform better. If you want shorter wait times, more choices, or lower taxes, your opinion might be completely different. That's why healthcare is such a difficult topic. There isn't a perfect system. Every country is making trade offs between cost, access, quality, and speed. Spend more money and you might get faster care. Spend less money and you may have to wait longer. Offer everyone coverage and taxes may be higher. Keep taxes lower and more people may have to rely on private insurance. No country has completely solved the healthcare puzzle. They're all trying to balance out the same four goals: making healthcare affordable, providing high quality care, giving people access when they need it, and keeping the entire system financially sustainable. So, next time someone says one country has the best healthcare system, remember, it really depends on what they mean by best, because every system solves the same problems while creating others. And that's something worth thinking about. Thanks for listening to the stuff you should think about. If you enjoyed today's episode, be sure to follow the podcast and share it with someone who loves learning something new. Until next time, keep asking questions because there's always something worth thinking about.